As doctors across the country continue their collective action to protest the reform, the government today raised its healthcare crisis warning to severe, which is unprecedented. This means non-face-to-face treatment will be boosted while public hospitals will be on full standby. Do-yeon starts us off.
As the resignations of South Korea's trainee doctors continue to worsen the stability of the country's medical system, the South Korean government has come up with a new measure for the public to be able to reach a doctor. Telemedicine.
The government will, starting today, fully expand telemedicine to make it easier for people to receive general treatment.
This came on Friday at the first Central Disaster and Safety Countermeasure headquarters meeting chaired by Prime Minister Han Duck-soo to discuss the doctors' collective action against raising the medical school enrollment quota. Before now, telemedicine had been partially available since 2020 during COVID-19 under strict regulations. Only higher-tier hospitals were entitled to provide the service for non-first-time patients, plus for people in remote areas and for appointments at night and on holidays. With the restriction gone until the collective action is finished, non-urgent patients who had their appointments postponed are able to set up a virtual appointment. The government has announced that it will maximize the use of public hospitals as well.
We will maximize the operational level of public healthcare institutions. We will extend the weekday operating hours of all public healthcare institutions to the maximum possible and also expand medical services on weekends and holidays.
Emergency rooms will remain open for 24 hours despite the shortage of specialist personnel. 4 new control centers will open in March to ensure patients with emergencies can be treated on time. Furthermore, employment regulations will be loosened for the time being to help hospitals hire more medical staff. Military doctors will be on duty in hospitals where needed. This comes after the government raised its health and medical treatment disaster crisis warning level to severe as of 8 a.m. Friday, which is one step up from the previous level of alert. With the change, the Central Disaster and Safety Countermeasure headquarters is now dealing with the government's response to the protest. Friday marks the 4th day of the mass walkout. So far, over 9,000 intern and resident doctors have handed in their resignations. That's around 71% of all trainee doctors. Of those 9,000, around 8,000 have left their posts in hospitals. Do-yeon, 아리랑뉴스.